This is a brief webinar about the Affordable Care Act in Colorado, brought to you by the state of Colorado. I'm Sue Birch. I'm the Executive Director for the Colorado Department of Healthcare Policy and Financing.
And this is Marguerite Salazar, Insurance Commissioner for Colorado. I'll be joining Sue in the discussion.
The purpose of this presentation, hosted by the Department of Healthcare Policy and Financing and the Division of Insurance, is to provide consumers key information about the Affordable Care Act, or healthcare reform, and its impact on Colorado. This presentation will not provide specific information about health insurance plans, but rather provides a broad overview of all the changes that are occurring. During this presentation, we will cover the following topics: an overview of the Affordable Care Act and Colorado's path to increasing coverage, who does what, changes to the private health insurance market, changes to the public health insurance plans, how to apply, resources for more information. The Affordable Care Act has broad impacts across both public and private health insurance, healthcare providers, and on Coloradans, both those who currently have coverage and those without health insurance. The goals of the Affordable Care Act are to, first, protect consumers, improve affordability, hold insurers accountable. Next, expand coverage to those who are currently uninsured. Third, to contain costs for public and private programs. And last, to crack down on waste, fraud, and abuse in Medicare and Medicaid. Now, it's really important that here in Colorado that the state agencies continue to work together for Colorado. The changing healthcare landscape requires that our partners align and closely work together. The Department of Healthcare Policy and Financing administers the Medicaid and Child Health Plan Plus programs, as well as a variety of other health insurance programs for low-income Coloradans. The Department of Public Health and Environment administers programs that seek to improve health outcomes through the promotion of health, wellness, and prevention, and has some regulatory oversight. And the Department of Human Services administers programs such as food and cash assistance that improve the safety, independence, and well-being of Coloradans. Human Services also works closely with the Department of Healthcare Policy and Financing on the coordination of behavioral health care and substance use disorder Medicaid benefits.
Next comes the Department of Regulatory Agencies, which is home to the Division of Insurance. Now, we regulate all private insurance industry to ensure that companies follow the laws, but also to make sure that they can afford to pay their claims. We work with consumers to answer questions, we help them understand their insurance, and we ensure that they receive the benefits for which they have paid. Lastly, Connect for Health Colorado, our health insurance marketplace, which many people also know as the Exchange, is our final partner. Though not a state agency, Connect for Health Colorado works closely with the state to provide a way for individuals, families, and small employers to compare health plan options, apply for insurance affordability programs, and to actually buy health insurance and use new financial help to reduce the cost of insurance.
Now, healthcare reform has begun, and there are some key dates that you need to know about. You should be aware that January 1, 2014 is the earliest coverage can begin for those Coloradans who are newly eligible for Medicaid. Additionally, coverage purchased through Connect for Health Colorado Marketplace can begin as early as January 1, 2014 as well. The Connect for Health Colorado Marketplace open enrollment period closes on March 31st, 2014. For more information on Connect for Health Colorado open enrollment period that's upcoming, visit connectforhealthco.com. It's important to remember that programs administered by the Department of Healthcare Policy and Financing, including Medicaid and Child Health Plan Plus, do not have an open enrollment period, and you can apply at any time throughout the year. At this time, Commissioner Marguerite Salazar is going to tell you about the key changes to private health insurance.
Thank you, Sue. Of course, there are many changes coming for 2014, but before I talk about those, I want to emphasize that for many people, there will be few, if any, changes. Most people with health insurance in Colorado and the United States get that insurance from their employers, and for most people, that will not change. Most employers offering health insurance to their employees will continue to do so. The changes for 2014 do not really apply to large employers, those with 50 or more employees. Changes to large employer insurance will be coming in the next few years, but since 2010, most large employers have already been making improvements to the plans to comply with the ACA. The big changes for health insurance for 2014 are for individual plans. That's the health insurance purchased by people who do not get insurance from their employer. There also are changes for the group health insurance plans sold for small employers. Those are people or groups with less than 50 employees. There are new requirements for insurance, along with new ways to shop for health insurance and new ways to make it more affordable, since one of the key reasons that people didn't have insurance was because they couldn't afford it. While there are many changes coming up, I want to highlight some of the very big ones. First of all, let's talk about essential health benefits. These are benefits that are specific healthcare services that must be covered by all plans that start in 2014, or actually are being sold in 2014 as well. These features make the insurance more robust and useful to consumers. They include coverage for such things as hospitalization, emergency services, laboratory services, prescription drugs, mental health services, maternity and newborn care, and preventive and disease management services. Now, why these are important go back to the fact that many people would purchase insurance and not understand what benefits were a part of that insurance plan. By having a standardized set of benefits, everybody knows what is expected that they will have when they purchase insurance. One of the great things about the ACA is that you cannot be denied health insurance because of a pre-existing condition. It used to be that for individuals buying their own insurance, insurance companies could deny coverage. They could charge higher premiums or not cover your medical conditions based on your health history. And you had to submit all the information so that they could evaluate that and make their decisions. In 2014, these practices are not allowed. In fact, in applying for health insurance, you can only be asked about your tobacco use. Your health insurance cannot be canceled if you get sick or injured. Again, it used to be that insurance companies sometimes canceled a person's coverage if they became seriously sick or injured. Starting in 2014, that is no longer allowed. Connect for Health Colorado, as I mentioned earlier, is a new marketplace for Coloradans to shop for health insurance. While many states did not build their own health exchange, Colorado did, building a solution by Colorado and for Colorado. Our citizens do not need to go directly to healthcare.gov, but they can visit connectforhealthco.com to browse, compare, and ultimately buy insurance from many different insurance companies with varying levels of coverage and premiums. Because affordability is a key component of the ACA, tax credits based on income are available for many people to help with the cost of health insurance. The state of Colorado also expanded the availability of Medicaid for its citizens, but I'm going to let Sue talk more about that in her portion of this presentation. So what is the marketplace? And remember that I mentioned earlier that some people still refer to it as the exchange. The goal is to simply create a better shopping experience for health insurance. It's a way that you can compare, you can shop, you determine if you're eligible for a tax credit. You can call, text, sit down, talk to call center folks. You can actually apply on paper if you'd like. But that's exactly what the marketplace is, and we encourage you to go to the website and just look at it. It's very, very user-friendly, and we want you to know what you're buying before you actually make that purchase. The tax credits, or as they are formally known, the Advanced Premium Tax Credits, or APTC, are a very important feature of the ACA. They're available for people with household incomes up to 400% of the federal poverty level, which corresponds to the higher income figures in the table. They are only available for health insurance plans purchased through Connect for Health Colorado. They are based on your household's modified adjusted gross income and what you are expected to pay for insurance, which is between 2 and 9.5% of your income. So that really does depend on what your income is, compared to the cost of insurance in your community. This means that if insurance is more expensive in your area, the tax credit is adjusted for that regional cost difference. The assistance is determined on a sliding scale, so the tax credit goes down the more you make. The tax credit is available for individuals with household incomes between $15,000 and $46,000, for couples between $20,000 and $62,000, and for a family of 4, as an example, between $31,000 and $94,000. Connect for Health Colorado are the experts on the tax credits, so any questions should be directed to them. We know it's very complicated, and so we want you to be able to sit down with an individual and look at your specific case. The number is 1-855-752-6749, or you can always just go directly to the website, which is connectforhealthco.com. Because this is such a change to the world of health insurance, there have been many news stories both at the local and the national level. While I can't address everything, I want to share some information about a few of these. You may have heard that a number of individuals and small employers in Colorado had their plans canceled in anticipation of 2014. Because health insurance companies were gearing up for 2014, they created new plans to comply with the requirements of the ACA, so many companies did terminate many of their old existing plans. However, you should know that almost all of the people affected by these cancellations were offered the option to renew that plan and carry it into 2014. Those were called the early renewals, but it has to be done in 2013 or it's not an early renewal. Not all Coloradans have chosen this renewal option, and those that do not will have to buy health insurance from another source, either through their employer, through Connect for Health Colorado. They can go to their broker directly to an insurance company or work with their agent. The problems of the federal site, which is healthcare.gov, have been well documented by the media. However, Coloradans do not have to worry about those problems, as they do not need to use healthcare.gov. Colorado built its own healthcare exchange to serve its citizens, Connect for Health Colorado. So again, if you can tell your friends and neighbors that all the problems that are happening at the federal level do not directly impact your ability to use the exchange here in Colorado. Differences in the cost of health insurance among different areas is also something that is not new. The cost of healthcare differs from region to region, and it's based on many factors: the availability of doctors and hospitals, the availability of services, the health and wellness of a population, and the general patterns of how healthcare is used. The ACA allows insurance companies to vary the price of their insurance based on where people live. This can mean higher insurance costs for some of the regions with higher healthcare costs. It's important to remember that tax credits are designed to make insurance more affordable. Also important to remember is that the amount of the tax credit is proportional to the cost of the insurance in an area. So people who qualify for a tax credit in the higher cost area will be able to get more to help with that cost.
Now I'd like to talk to you about changes to the public health insurance. We know more than 60% of Coloradans get health insurance coverage through their employer, the private side, and we expect this to continue to be the case going forward. But for those who can't afford private health insurance, laws passed in Colorado have given Colorado the ability to provide additional ways to get health care coverage. One of those ways is through the expansion of the Medicaid program. Medicaid provides free or low-cost health insurance to low-income Coloradans who qualify. Medicaid covers a wide array of benefits and services to help keep you healthy, including services such as doctor visits, emergency care, hospitalization, rehabilitative services, prescription drugs, maternity care, newborn care, and many others. Additionally, beginning in April 2014, Medicaid will provide an adult dental service benefit focused on prevention. Now you might be wondering who qualifies for Medicaid, and I'd like to take you through some of the income qualifications. Beginning in January 2014, more adults without children and parents may qualify for this free or low-cost coverage from Medicaid. You may qualify for Medicaid if you earn about $15,000 a year as an individual, or for a family of 4, about $31,000 per year. If you're on the Child Health Plan Plus, the income criteria will remain the same and still be available for children and pregnant women. And you may qualify for the Child Health Plan Plus if you're earning about $29,800 a year or up to $61,200 per year as a family of 4. The Medicaid expansion population includes working Coloradans we encounter every day and that we really depend on to keep our economy going. They are working in our nursing homes, our schools, our restaurants. There are bus drivers, there are school staff, there are all sorts of hardworking Coloradans. And this expansion will not only cover about 160,000 Coloradans, but will also help our state gain about 22,400 new jobs by the year 2026, including over 14,300 in the first 18 months of the implementation. Additionally, the Medicaid expansion stimulates about $4.4 billion in economic activity here in Colorado. And we're pleased to report that it'll increase the average annual household earnings by $608 a year by 2026. Now that we've told you a little bit about the new ways Coloradans can get health insurance coverage in both the private market and the public market, it's important for you to know what options you have to apply. So let's review these. You can apply in a variety of ways, including online, by phone, in person, or by mail. All of these ways can be undertaken through both the Department of Healthcare Policy and Financing or through Connect for Health Colorado. Consumers can receive help completing an application in person or over the phone. If you are not sure where to start, go to colorado.gov/health or call the Medicaid Customer Contact Center at 1-800-221-3943 or Connect for Health Colorado at 1-855-PLANS-4U. Both the Department of Healthcare Policy and Financing and Connect for Health Colorado will be able to direct applicants to the appropriate assistance. Healthcare Policy and Financing, Public Health and Environment, Human Services, and the Division of Insurance have collaborated on a new consumer-friendly website, and you can go to colorado.gov/health. This site is here to help direct Coloradans to resources related to health and healthcare. The site includes an array of frequently asked questions, videos, and other resources to help explain to consumers how the changes in healthcare will impact them. If you have questions about healthcare reform, the Medicaid expansion, or Connect for Health Colorado, again, go to colorado.gov/health. Clients and applicants can also get more information about health insurance options via the phone from the Department of Healthcare Policy and Financing and Connect for Health Colorado. Also, consumers can also seek assistance from the Division of Insurance in regards to insurance, agents, or insurance companies by calling Consumer Affairs. Closing, on behalf of the State of Colorado's Health and Human Service Departments and the Division of Insurance, we thank you for your interest in our new healthcare reform provisions.
And remember, better decisions make you better prepared, so stay healthy.